I think about, as a clinician, right? How can we really work to, close those gaps and address disparities, because we know that they're there and they're not going to go away, but we certainly want to take those on. And I think about maybe UDS Plus, this patient level data, is going to allow us to, create some innovative approaches.
Had we not provided those services, he may have never known, or it could have been too late when he found out. And there are people out there who need these benefits and the care provided by health centers. Without patient-level data, the government doesn't realize how important CHCs are in the lives of our patients.
I see a crosswalk really between UDS Plus and value-based payment programs that are ramping up even more so for 2025.
Welcome to the Ambulatory Healthcare Today podcast, hosted by the NextGen advisors. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Hello, everyone. Welcome to the Ambulatory Healthcare Today podcast. I'm really excited because we're co-presenting with one of my favorite people from OSIS. I love working with OSIS. OSIS is one of NextGen's enhanced premier strategic partners for FQHCs, federally qualified health centers, and community health centers. Great to be with you. I'm Michele Hannagan. If you haven't met me, I'm Director of Specialty Solutions here at NextGen Healthcare. And like many of our listeners, I come from the health center world, and I have a deep experience and just deep affection for community health centers. So let me tell you a little bit about OSIS before we dive in. OSIS is a nonprofit technology services organization and also a health center control network, an HCCN, mostly representing NextGen Healthcare health centers. OSIS's mission is to strengthen the NextGen experience, which they do fabulously. They share commonalities and best practices that drive innovation and efficiency, and we're certainly going to hear more from Rebecca on that, which we're excited about. So on today's podcast, we're going to be deep diving into the lived experience of UDS Plus, which is near and dear to many hearts, as many of you know UDS very, very well. So joining us today on our podcast are two seasoned experts when it comes to the lived realities of federally qualified health centers, or FQHCs, as they are known in the industry. First up, as I referenced, my colleague from OSIS, Rebecca Rudd, who is a registered nurse and has a billion credentials after her name. I just want to call that out. She's deeply knowledgeable. Director of Government Affairs with OSIS. She spent her entire career in patient care delivery and mission-driven system support. That's critically important as we go through our conversation today. Rebecca really knows the goods. She knows both sides of the equation, from the clinical and non-clinical reporting requirements for all that government affairs work. And as a leader in her HCCN, she meets regularly with the people who deliver care at health centers and the government folks who are supplying the requirements that health centers have to deal with. And we all know sometimes those requirements make us a little crazy, and it's really helpful to have people who can get us over the finish line. And Rebecca is top notch. She helps with untangling the who, the what, the where, the when, and the why, and how for many FQs, including our other guest today, Health Center in North Carolina. So that brings me to our second guest today is Tracie Zeagler, another nurse. Really excited to have all our clinical knowledge here today. Tracie's Director of Health Informatics and Information Management at Kinston Community Health Center in Kinston, North Carolina. And speaking of Kinston, some of our listeners may recall or may have even listened to the podcast we did earlier in 2024 with one of Tracie's colleagues, Anna Kinsey, and our friends from Find Help. Kinston is no stranger to being a pioneer. They were the first NextGen FQHC across the finish line for UDS Plus Cohort 1. Those are some serious bragging rights right there. So as I mentioned, Tracie's also a nurse. She joins us today from the place where many of you are today, and that is that level of patient care coupled with administrative challenges, administrative realities of reporting to various entities like HRSA, or the Health Resource Service Administration, as it's more formally known. So I'd like to remind folks who may not understand all the FQHC alphabet soup stuff that you'll hear. Some of you might be new to health centers. HRSA is what I used to refer to as the big boss, though I think they would also agree, and we all agree, that at the end of the day, patients always come first. And that's what we're all about. So Tracie and Rebecca, welcome to our show, and thank you so much for joining.
Thank you for having us.
All right. So we've got a lot of stuff that we want to cover today. So let's start with some background and context. And again, I know many of our listeners are probably well familiar with FQHC, but you never know. There's new folks coming all the time into health centers. Maybe you've come from non-healthcare, maybe you come from a hospital system or a different entity out in the community. So in case anyone is new to that health center movement, we're going to talk a little bit about what is UDS, what is UDS Plus, and I'll start with Rebecca in just a moment. So UDS, or Uniform Data System, right? It's the annual report that FQHCs and FQHC lookalikes have to submit to HRSA. So it's an annual report due every February. How about you share with us, Rebecca, and everyone, your perspective on what UDS today is and how is UDS Plus different?
Thank you, Michele. So UDS today is now being referenced as legacy UDS. So it really is a measure of how the health center program is doing across the nation in terms of the care that is rendered and the services that are rendered and how much per patient cost there is associated with it. But since that UDS reporting became required, it's always been collected by health centers very inconsistently and by various means across any health center. It could be manual, it could be automated, it could be different reports. There's no equalness to it in how health centers report it. And that's sort of why they refer to it as legacy. So it's really a manual process today. And the UDS Plus is going to move us into the new age of standardized reporting. I'm so excited about it, actually, because it's going to give us so much transparency and equal assessment. It's based upon the same set of standards. So I'm excited for UDS Plus. Appreciate everything that the current UDS legacy is giving us, but I think we're going to have so much more data to be able to analyze for the care that we give at health centers.
That's really great, Rebecca. And I want everyone to hear, she did say excited about UDS Plus. Now that's coming, it's saying something, because, living in the health center world, no one really is excited about UDS, right? It's, we got to do our UDS report. It's required for your 330 funding. Everyone knows that. And I have to agree, Rebecca, I think there is something exciting about what this is going to do for health centers. I'm going to talk a little bit more about that. And so I'm very appreciative of your call out of the excitement there, because this really is going to help health centers like Kinston. So, before we go a little bit too deep into all of that. So Tracie, tell us about Kinston, tell us about you and your community, and let us learn a little bit more.
So Kinston Community Health Center is a FQHC in Eastern North Carolina. We're about an hour and a half from the coast and about 4 to 5 hours from the mountains. So we're, smack in the middle of the coastal area. We serve about 9,000 patients, and of that we have about 2,000 migrants. So we do have a 330G grant, and we serve, we have a migrant grant. So we do a lot of outreach with our patients, especially our Spanish-speaking patients. We have medical, family medicine, and pediatrics. We have OBGYN, behavioral health, including psychiatry and MAT, or substance abuse disorder treatments. We have dental, and like I said, we have a strong outreach department that really goes out and takes care of and reaches the patients where they need to be.
So you've got a lot of different lines of service providing, care similar to many of our listeners are providing care today. And, you're pretty involved with the UDS reporting process, I'm imagining, yeah?
Everything except financial, I do.
Yeah. So again, going back to that experience that we talked about at the beginning and why conversations like this are important to have with partners. You've got NextGen as a vendor, you've got the health centers and our partners with OSIS and Health Center Control Network. So thank you, Tracie, and I'm excited to dig in a little bit more here. So Rebecca gave us a little bit of that what and why about UDS Plus, and let's just dig just for a second a bit deeper into that why point. So many people, might think this is, just another exercise in a regulatory requirement or government red tape, or, why do we have to do yet another thing? Because it does provide friction, shall we say, in our world, but over the last year, more than year, I can say I've been a part of the UTCs. I've been working with many folks, including Rebecca and many, many others, and Tracie. And I have heard from HRSA, whether it's in person, on site, during conferences, that they are extremely committed to reducing burden, right, for health centers, aligning with standards like with ONC, and that, ultimately this UDS modernization effort is about benefiting patients and the health center movement. So I'd like to say that I agree with that. But Tracie, I'd like to start with you. What do you think of my assessment? Off base? Would you agree? Why or why not?
I think you're right on the money, Michele. Providing this patient level data will provide more insight to what health centers actually do, who they see, and how big the need is for the access and supportive services that we offer. We see some of the sickest patients in terms of chronic conditions, and by getting that data broke down to the patient level, the government will actually be able to understand what we do and who we serve, and hopefully see how important it is to continue funding the health centers. For example, recently we had a lung cancer screening project for our self-pay and uninsured patients. We had a patient who came to the screening and thanked us for giving him that opportunity. He said, had it not been that provided to him, then he would have never have had that done. He was found out to have lung cancer.
Oh, wow.
And this was his first ever screening.
Wow.
Had we not provided those services, he may have never known, or it could have been too late when he found out. And there are people out there who need these benefits and the care provided by health centers. Without patient level data, the government doesn't realize how important CHCs are in the lives of our patients. And I too am looking forward to the modernization, because it will take off the tedious manually inputting that information, and it will automatically send based on what NextGen has set up.
Yeah, that is so well said, Tracie. And I said it earlier. Ultimately, everything we do, whether you're a health center, an HCCN, or even a vendor, we are all about trying to drive a difference in the lives of our community members, the people, right?
Yes.
We share community. So thank you for that call out. And Rebecca, I think Tracie mentioned this, and I believe this very much in what I'm hearing, that, this is important to benefit health centers as they're employers. They are in our communities, and the message in aggregate is now changing to patient level. So what are your thoughts to say, how is this going to benefit health centers and maybe the movement, whether it's funding or recognition?
So Tracie's story gave me goosebumps. Just hearing something live and in action with a patient, it just energizes me because of the care that's being given at these health centers. The health center program overall is going to benefit from UDS modernization. Again, as I mentioned earlier, that transparency in evaluating our patient outcomes, along with the effectiveness and efficiencies of the services that we deliver under federal funding. We've got to be able to show what we're doing with the money, per se. So once every health center is reporting with the same definitions and interpretation, the data integrity is going to be so welcome compared to the inconsistent data that we have for today's program impacts. Again, exciting for me because it puts us all on the same playing field.
Right? Remember the days of 70 chart pulls?
Oh,
Remember?
Yeah.
Oh, we used to say EHRs are going to help because I'm not going to have to try to decipher what this person wrote in the chart, much less trying to find the charts, which was, an effort in
a chore.
Frustration. Yeah, telling that story. It's really great. So let's go a little further, because the implementation of this, right, is what many people are probably thinking about. How am I going to do that? So there's implementation, and there's certainly benefits. So we're turning to a new technology, a new regulation, a new way of reporting, which is really what UDS Plus is. We're going from aggregate to patient level using a technology called FHIR. So when we think about this, there is the question that plagues busy health center staff. And I think it probably plagues the health center controlled networks as well. We need to really up our game when it comes to workflows. How do we implement changes for UDS Plus in really manageable ways? So let's talk a little bit about workflows implementation. And Rebecca, I'd like to start with you again. Building on what you said earlier about the why, you have really been a champion of how staff need to document so that all of the raw data of all of the stories are being documented. And I've heard Jim McCrae say this on many times, many occasions. We're talking about adopting workflows that work for the team. So tell us about how you and OSIS work with FQHC staff to educate and implement best practices that would really impact UDS Plus.
Yeah. Michele, you and Tracie are nurses like I am, so you're going to understand when I say I always seem to go back to the lessons learned long ago. If it isn't documented or recorded, it didn't happen. It wasn't done. Always paint the picture, right? So I always go back to that when I'm thinking about UDS Plus. So the healthcare landscape, it's ever changing, especially now with patients, payers, and other stakeholders all expecting transparency, access to the records. Information blocking, is out there, and we all make sure we get those records out the door when they're requested. But OSIS really works with health centers across the nation to establish best practice workflows, not only for regulatory reasons, but also to fully paint the picture of care and services rendered. I found that if providers and staff understand the why I'm asking them to do things, they're really more willing to meet the need for the benefit of the patient and the health center as a whole. And by having that information at point of care, we can definitely improve patient outcomes, reduce the cost of duplicate testing, for example, and just deliver effective care. It is a different way. They have to document and paint that picture, and sometimes that is different. So there is a struggle, but in the end, it's really the best.
Yeah, and I will say, I've learned from talking to many health centers who've worked with OSIS, you're just so good, so solid on that clinical workflow support. And like you said, Rebecca, painting the picture and listeners really take this in. I know I've been there. It's, I can't ask my clinicians to, pull a CPT code versus they want a free text, but painting that picture is important for the longevity of the health centers and of course for the patients we serve. So I appreciate that perspective. And Tracie, definitely want to hear from you. What's Kinston's approach to getting UDS Plus up and running?
Well, we've been working on refining and reinforcing and just getting the correct workflows for UDS and UDS Plus documentation for several years. Each year, we have to audit the reports to identify if there's any documentation gaps and address those with training through to clinical staff to make sure that they are understanding where they are supposed to document. Just recently, we found we had an issue with our Cologuards not catching, and so we're having to go through and audit the colorectal cancer screening to make sure that we have the information, we can fix our data. When the UDS requirements changed on the race and ethnicity options last year, I set up our system to only allow for those options for selection. Nothing extra, nothing more, nothing less. But that ensured we would not have any outliers and that our data would be clean for UDS acceptance. If the staff are documented in the right places, then the data will pull correctly and provide clean reporting, which makes everybody's job easier on the back end. When we submitted the UDS Plus beta testing data, our staff had no idea what was happening. They already had the correct workflows in place. No changes or adjustments were needed. It was just me in the background doing my thing and working with NextGen and OSIS to make sure we had everything going through, but the staff had no idea.
Now, isn't that a great shout out to all the folks in the background? We talk all the time about, the people who are delivering care, certainly important, clinicians, nurses, all the folks really interfacing directly with patients, right?
Yeah.
And there are a lot of people in the background who are making life as easy as possible for the people who are performing the direct care. So big shout out to your team on that, Tracie. And again, another reason why, connecting with your vendor and with your partner like OSIS can really help with that. So, there's certainly some early hurdles, right? We always talk about the hurdles. And there are probably some early benefits too. So I'd love to hear from each of you. What did you encounter along the way in terms of hurdles and benefits? And Rebecca, you want to go first with this one?
Yeah. Well, Michele, not very many were jumping at the opportunity to submit data to HRSA. That's for sure. There was lots of skepticism of how concerning the standardized data collection would impact their funding possibly. They didn't understand that there was no penalties. The cohort testers that elected to engage were really pleasantly surprised to find that NextGen had most of the mapping and coding already available out of the box. They didn't have to do much. Really what they had to fix was the things that they had added themselves most often. And of course, HRSA was learning along with the rest of us. So it is key to remember that HRSA is on our side. They're learning as we go in the adoption. They're adopting as well. There will continue to be lots of aha moments and realization that our patients are unique and present different challenges and barriers when they're looking at that data. So they're realizing that through all this testing, that's for sure.
Yeah.
2025 data submission is not your source of record. And this is another opportunity to examine your NextGen configuration to meet those regulatory requirements for reporting. And the biggest takeaway, it wasn't as scary as everyone thought it was going to be. Like Tracie said, most people never even knew that they were participating in it at the lower levels, at receptionists, MAs. They had no clue.
That is a huge call out, right? So there, I heard learning, and I will say, I would totally echo and agree with you. HRSA is very transparent with us about, hey, we're learning too. That to me in and of itself is a great benefit in this, because often, it's like, oh, I got to do it. It's regulatory. HRSA wants to learn as well. And they're definitely learning from and with us, which, Tracie, I'd love to hear your thoughts on this as well.
So one of the biggest hurdles I encountered was the NextGen beta UDS prototype.
Yeah.
But let's admit it, there were issues.
Yeah, sure.
But NextGen was really responsive, and when I would identify an issue, they would work on correcting the coding and their scripts in the background. They would pull the correct, to help pull the correct data for the patient. I would audit, what they sent me, and I would check to make sure that it was correct and everything was de-identified. And, once that was all taken care of, there were not that many issues. I would do audits on the sampling, like I said, and just to make sure that, whether the patient did or did not have the information, and it would tell you, yes, they did meet the criteria, or no, they didn't. And then when the submit day came, it was pretty much on NextGen. I was on the phone with NextGen and HRSA and whoever else, and we just walked and talked through it, and then they submitted it for me. I didn't have to go in and push a button or enter any numbers. It was pretty much a lot less work for me on the back end.
Yeah, and I'm so glad you called out the, bumpiness with the NextGen prototype. Like, we definitely know that we are learning as well. So I think entering into this, which you both have called out, HRSA's learning, health centers are learning, the vendors are learning, and that collaborative space, we talk about the monthly UTC, the UDS test cooperative calls, there very much is a feeling of collaboration in this, and we're very grateful to be able to learn with and from our health centers and our partners. So thanks to you both on that. Okay, so let's turn to data utilization and impact. Let's kind of get us to that next level. So, thinking about the future of where we're going, and I know some of this is trying to look into a crystal ball and predict, and we're not really sure. We've been on this road, a couple of years now. Based on what you're encountering, Rebecca, what are you hearing in your circles as an HCCN leader? How this patient level data, the de-identified patient level data, is going to be used by HRSA?
Yeah, there still really remains a sense of unknown of how HRSA is going to use UDS plus data. They have been receiving our data for years, technically. This just offers a new level of analysis to evaluate our health center program. I think that they'll be using it more with a collaboration with other organizations like CDC, I just envision the data being utilized to increase opportunities for health centers. And I think that's on the positive side. I think that's really going to open the doors for health centers for additional funding once our patient populations are clear, from the level of care and support that they're getting from health centers. So at the current time, little unknown, but I'm going to remain optimistic that it's going to improve opportunities for health centers.
Yeah, I would agree. I'm going to remain optimistic and, definitely want to get Tracie's perspective on this and, you feeling optimistic and, how do you think UDS plus data is going to guide your health centers' decision making and maybe future planning for things?
So we'll be using the data to help identify locations of higher need for our medical mobile unit to visit. If we know that there's a need or say there's a community that has a higher need for certain care, we can take the mobile unit there to provide that care where they need it or where they are. We also will use this to help guide some of our QI/QA team focuses and our QI initiatives and population health activities.
Love that. And I think about the examples that I'd love to hear more, what you're hearing, what you both are seeing, about using the data to improve patient care and health outcomes. So Tracie, you just mentioned a little bit about where you'd like to maybe go. And, I think about, as a clinician, right, how can we really work to, close those gaps and address disparities, because we know that they're there and they're not going to go away, but we certainly want to take those on. And I think about maybe UDS Plus, this patient level data, is going to allow us to, create some innovative approaches, maybe to chronic conditions or something like, immunizations. I don't know, Tracie, I'd love your thoughts on that.
So as I said earlier, we'll use this to identify areas of need. So if we find a certain zip code has lower childhood immunization rates, we can focus on having well child checks and immunization clinics on the mobile unit in those communities. We can identify areas with higher uncontrolled diabetes and have our outreach department provide A1C checks and diabetes education, and provide information. We have a food bus that comes around once a week, but they drive up to our community health center and they provide low cost, healthy, fresh foods to our patients in the community. And it's a lot of it is pay what you can.
Oh, so
wow. That we can get that information out there. We may even be able to say, okay, we need to take this bus while it comes here. We may need to schedule it to go to an area that needs it as well. So we can really use this data to help drive our outreach area.
Yeah, and now you're getting to the social drivers, right?
Yes.
Yes. Social drivers of health. That is, we got to get beyond. Obviously, I know I'm preaching to the choir. We can't just focus on, got to take that antihypertensive. Food deserts and the ability to get affordable food. I love that. I really hope that you get some innovative dollars to get those kind of programs going. And would love to hear your thoughts, Rebecca, on this as well.
Yeah. I see a crosswalk really between UDS Plus and value-based payment programs that are ramping up even more so for 2025. And having the ability to really define specific patient populations by nationally adopted standards provides really the opportunity for us to dedicate, as Tracie mentioned, that care coordination and management. And of course, this relies on interoperability for data sharing. So also, I have found that health centers are far more advanced in using the NextGen technology or for data sharing, and they're more willing to eliminate those manual processes. Within the platform, there's a lot of functionality for clinical reconciliation of incoming health information exchange information or HIE information. For a more complete patient chart, it all leads back again to improve outcomes and patient safety.
Yeah, that's terrific. So you mentioned, the interoperability and being able to use NextGen. So is there a specific way NextGen supports you, Tracie, in your patient efforts? And, I know there's a lot of conversation about how to report, and, there's no requirement that you use your vendor. You can use a third party. Many people are using different platforms, if you will, but would love to hear your 2 cents on how NextGen supports you and, your thoughts on using your EHR vendor as your UDS Plus reporting tool.
So our population health platform is actually able to submit, but I would not want to submit with anybody except my EHR vendor, because I know where the mappings are and where the data is pulled from in our EHR. The population health tool is good and it's close to match to the EHR data, but there's some discrepancies sometimes. They may not actually be able to map exactly to one of the places that we have information. So I trust my EHR data and NextGen to help me with my UDS and UDS Plus submission. I wouldn't trust my EHR data to be submitted to her except from my EHR.
Yeah, and I think the call out for that I want to make sure I underscore, because, obviously we're talking about NextGen as a vendor, but it pushes the vendors to be really accountable. It pushes us to really get the raw data, that whole pathway, the whole mechanism of reporting. It really pushes us to do a top-notch job, which is absolutely the focus that we have here internally. And what I love is having conversations like this with clients who are at health centers and our partners like OSIS. Rebecca will keep us honest all day long. And I love that, because that's how we need to be sharp going forward, really providing all the services and solutions that health centers need. So I appreciate
And I loved that NextGen was out there in the front with EHR saying, we're going to get this, we're going to make it happen. We're not going to sit back and wait and see what everybody else does. They were being, go-getters.
It was a proud moment. Woo!
Yeah, agreed. Yeah, I love that as well, because that, we can't shrink away from UDS. It's how we tell our stories. And, it might be that icky time of year when we got to do the UDS report, and we all know that without the data, the stories don't get told, the funding doesn't come, in advance. And, we need to be thinking about that, and all ways that health centers can be at the table, if you will. And, that's a whole other conversation about, AI and how we're making sure that the voices of those who are in health centers, both the staff and the patients, are really heard. So I couldn't agree more with you both. And we're kind of getting short on time here, and I want to make sure that I give you each the opportunity to, offer a little bit of advice to any of our listeners. If you are thinking about, gonna go to UDS Plus, I'm gonna do this, what advice would you offer your fellow health center listeners, Tracie?
Go ahead and start working on it, because it's coming whether you like it or not. It's just going to happen. So you may as well go ahead and be in front of it. I've always been one that likes to be in front of the ball instead of behind it. I've always been, on the cutting edge, so is what I like to say. So when UDS Plus was announced and the funding was provided to help health centers start getting ready for it, I went to my C-suite and said, we need to get in front of this. We need to jump on this sooner rather than later. And they supported me. And we teamed up with NextGen and OSIS to help get us ready for UDS Plus. I still have monthly or bi-monthly meetings with my OSIS consultant who helps me and asks me, do we have any questions? Are we running into issues? So it has been the best thing to get on top of it. I took advantage of it, contacted NextGen. So just don't be afraid to go ahead and do it. NextGen's there to support you all the way. They will walk with you. They will hold your hand. It's not been as scary as I thought it would have been. And so it's really just take the step. Go ahead.
Take the step. Love it. Rebecca, you're nodding your head. Like, any disagreement with that?
She's spot on.
Spot on. Don't shy away. Yeah. I like to say, gosh, if you've been living under a rock, now's the time to really take it on. It's UDS Plus is coming, and we really have got you here. So, as we look to wrap up here, I wonder if there was any surprise learnings that you had, related to the UDS Plus experience, Tracie?
Just making sure. I won't say I was surprised, because like I said, I made sure all of my mapping was exactly what HRSA was looking for, like with my race and ethnicities.
Okay.
So just make sure that your stuff is right. I patted myself on the back, so to say, when they said, you had everything mapped exactly like it was. That to me was like, well, I didn't know you could do anything extra, because I didn't want to, I don't want to do more than I have to. So yes, just do it. That's NextGen's going to work with you, and HRSA's not going to penalize you right now. So go for it.
Yeah. That's great. And I'm going to give Rebecca the last word here. Love, any of your feedback on anything you've learned, and definitely want you to tell listeners how they can learn more about OSIS and UDS Plus, and, how can they get more help if they've listened today and they're like, okay, I'm ready. I'm coming out from under that rock. How do I get some help?
I think the first thing is that if you're not already plugged in, join the UTC Test Cooperative via the BIPIC contact form. That's your first step in the door. And of course, reach out to your HRSA UTC region representative. I'm Region 1. There's several of us all across the states, and we're here to help you, guide you. We're not going to necessarily, have answers right at our cuff, but we're going to be able to help you get those answers that you might have. But I'm happy to assist anyone that reaches out to me to get you into contact with someone else on the UTC. OSIS, as a health center control network, we're funded by HRSA, so we're keeping a pulse on everything UDS and UDS Plus. Check out our website, as we offer a lot of free educational webinars on a regular basis, workflow ones even for UDS. Or just reach out to me for more information, and I'll get you definitely targeted in with some assistance.
Definitely true on that. And certainly tell listeners if you haven't connected with your account manager, you could even certainly talk to your account executive, but encourage you to reach out to your account manager to learn more about how to get enrolled, how to get the data migration, just to get that UDS Plus project underway. If you know that the deadline is April 30th, 2025 for that UDS Plus submission, and it is required. It is not optional. Not going to be penalized, but you do have to do it. So definitely reach out, contact your account manager. OSIS has got some great stuff on their website. And, I know from working with Tracie and many other health centers that if you've heard something Tracie said and you think, gosh, I'd really like to ask her more, Tracie has said she'd be happy to, chat with anybody, email with anybody, and really reinforce it's not as hard as you think. And we can definitely work together to get you across that finish line. So I am so grateful to both of you. I appreciate, you making time to sit with us here today to talk about this really important conversation. Tracie, Rebecca, thank you so much for being here today.
Thank you again for having us. I'm glad to be able to share this information.
Yeah, me too.
And I want to, thank our listeners. Thanks for tuning in to the Ambulatory Healthcare Today podcast. And to learn more about UDS Plus and how NextGen and OSIS can help you, reach out to your account manager, as I mentioned. If you're not already a subscriber to the Ambulatory Healthcare Today podcast, please follow along so you don't miss our next conversation. We really look forward to talking more, and thanks so much for being here today.
Thanks for listening to the Ambulatory Healthcare Today podcast, hosted by the NextGen Advisors. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.